Shalom, family. Good to see you all here. Hope you're all doing well. Well, there's a lot of people that have been cut already from Medicaid, and some have been cut before Donald Trump's big, beautiful bill passed. I don't even know why it's called that. What a stupid name for bill. But yeah, so a lot of people are mad, of course. Some of their children have been cut from Medicaid, many adults. And Donald Trump ran on he was not going to touch Medicaid. That's what he ran on. But then you cannot trust a criminal with 34 convictions to tell you the truth. He's sitting there and he's continuing to be a criminal, and nobody is stopping him. So, okay, so he made the promise on the campaign. Everybody is showing the recordings of Donald Trump. No, Medicaid won't be touched. And look at what he did. So you thought this criminal was telling you the truth. Well, Donald Trump is an Edomite and he's a 34 convicted felon. There is no truth in him at all. So I don't know why people are looking for Donald Trump to tell the truth when there is no truth in this man at all. So let me go ahead and share my screen so we can get started. All right. Please give me a one if you can see my screen. Shalom to everybody in the chat. Thank you.
I am losing my Medicaid and I would like to talk about it. Now, I don't know if you can see the swelling. I have taken the high dose of Zyrtec. I have taken a Benadryl and a Singulair. I have severe allergies. I'm allergic to the entire world and I'm losing my Medicaid. And before a single one of you jump in my comment section talking about able-bodied human being, I work 50 to 60 hours a week. I actually make very decent money as well. But because of my chronic illnesses, I qualified for a program that I actually pay. Yeah, let that sink in. I pay a monthly fee for my Medicaid. That way, my coverage is still being paid for, but it's affordable for me. To put it in perspective, I have to go to the allergy clinic 3 times a week. I get 3 shots every time I go. So if I have to pay a copay 3 times a week, plus every time I get hit with the needle, that's also a charge. And then the vials that they get my allergens mixed in are $900 a piece. So what happens now when my deductible goes to $9,000? I just get to suffer. Got it. If you voted for this, I will literally never forgive you.
So back about the second week of March, I got a letter from the state letting me know that I would be losing my Medicaid as of April 1st. So I have my own business and I made about $200 to $300 too much for a couple of months, and as such got kicked off. Despite the fact that they had deemed me medically frail years ago and that status had continued the entire time I was on Medicaid. There used to be a rule that if you were medically frail, you couldn't get kicked off Medicaid, but that rule went away. Thanks, Indiana. Good looking out. So I can't get back on Medicaid because I'm married now. So cool. As a quick rundown, I have an array of disabilities. I have hypermobile Ehlers-Danlos syndrome. It is a genetic disorder that causes my connective tissues in my entire body to not function properly. As such, I've had both my hips replaced. I have craniocervical instability, which causes chronic head and neck pain. It's now also causing ocular migraines pretty regularly. So just a lot of chronic pain. I also have major depressive disorder, an anxiety disorder, and ADHD. So I'm on about 8 different medications to keep me functioning, and also on something called Spravato. It is a nasal spray treatment that is for medication resistant major depressive disorder, which is what I have. So when I was first put on Spravato, I was in a really bad place. I was in a very dark place. It was emergent, and that is the point that they choose. If they're going to put you on Spravato, there's a couple different protocols they can choose from. I was put on the one for people who are at risk of taking their own life. So I was going twice a week for 4 weeks, and then put on once a week ongoing. So I've been going once a week for well over a year, and it has been life-saving for me. It has helped immensely, and yeah, it's been great. So now I'm on my wife's insurance through her work, where we have Cigna, and they don't want to cover Spravato. So luckily we have a lot of documentation, and my doctor feels really really good that we're going to be able to get them to approve it because of all the documentation we have. So they denied it, as we kind of expected they would. And on May 20th, he sent an appeal in marked as urgent for mental health. So it typically doesn't take very long to get an answer, especially when it's marked urgent, especially when it's for mental health. But we've been waiting and waiting and waiting, and we have heard nothing. They have tried calling and have gotten little to no answers. So yesterday at my doctor's urging, he said, if I were you, I would call Cigna today and I would throw a fit. He said, appeals shouldn't take this long, especially this kind of appeal. Okay, cool. So I decide I'm going to call. Now, I'm not having a very good day yesterday in general, but I'm like, you know what? I know I'm supposed to throw a fit, but I'm going to keep my cool. I'm going to keep my cool, and I'm not going to take my bad day out on these people. So I call. And they have a medical department, they have a pharmacy department. So I am on with the medical department. And the man says, let me check into this for you. So, I'm on with him for about 3 minutes. And he says, you know what? This is actually pharmacy. So I'm going to transfer you to pharmacy. Okay, cool. So he transfers me to pharmacy, and I'm on the phone with the pharmacy guy. I have to go back through the automated system, which is real fun. And the pharmacy guy, I'm on with him for about 5 minutes. He comes back. He says, you know what? This is actually medical. I'm going to transfer you to medical. I said, I'm going to stop you right there, sir. I was already on with medical. They sent me to pharmacy. I'm not going to be ping-ponged around because you guys can't get your shit together. He's like, I understand. But he was like, it is medical. I can't look into the systems I need to look into because I am pharmacy. Okay. He says, I'm going to directly transfer you so you don't have to go back through the system. Great. Thanks. Cool. Thanks. So he directly transferred me to the next person. It's a very nice lady. She, give her the rundown. She's like, all right, I'm going to look into this. Let me put you on hold. Okay, great. So she puts me on hold, and she's gone, and she's gone, and she's gone. And she comes back. I'm still checking into this for you. Okay, great. And spent a lot of time on hold, a lot of time on hold. And she can't find the appeal. She's looking, I'm going to check another system. Okay, great. Back on hold. Comes back. I'm going to check another system. Okay, great. How many systems do you need to check one person's file? Like, do I not have a file? Should I have a file that says, oh, Ronnie Morgan, here's all the things we need to know about Ronnie Morgan. Like, what year is it? Keeping my cool, though. I'm keeping my cool. So finally she comes back. I'm going to check one more system. I've yet to find the appeal. Okay, thanks. Back on hold. Luckily, she comes back. I found the appeal. It was sent in May 20th. Yep. She says, I'm not going to say it got lost in the system, but something happened. Sounds to me, ma'am, like it got lost in the system. This appeal that was marked urgent for mental health. So she's like, I'm going to go ahead and see what I can do about pushing this through. Okay, great. You going to mark that as urgent? Yes, I will go ahead and mark that as urgent. Great. Wonderful. So sounds like she's not entirely sure she can push it through. So I'm on hold again, another probably 10, 15 minutes. And she says, okay, I've gone ahead and I was able to push that through. I said, did you mark it as urgent? Yeah, yes, I was able to mark it as urgent. You should hear back in about 15 days. Great. Wonderful. So Cigna has customers who are in my position and worse. And that's the thing. Like, this is life-saving for me because I have a medication-resistant major depressive disorder. I have been on the chopping block more than once. And rather than do something about it when we have all the documentation we could possibly need, it just gets lost in your system. Just lost. Nobody knows. Are you kidding? So anyway, an hour and a half total. I didn't completely lose my shit on anyone, so that was really, special. And this is what we're dealing with. This is what we're dealing with. And now they're taking a lot of people's Medicaid away. And a lot of people are going to be without insurance or they're going to be dealing with this kind of shit. Really makes you feel warm and fuzzy.
Yeah. They say Medicaid is not impacted. I haven't been able to get into my Medicaid provider portal. Portals are down all across the country.
So overnight, they're talking about cutting Medicaid. Well, I am on the receiving end of being cut from Medicaid. Tennessee has a program called TennCare. I qualified because I had cervical cancer. If you have cancer, thankfully, they will treat you and you'll be fully covered in Tennessee. But for some reason, I got kicked off in 2022. And I don't really know why. I think it was when they were doing more cuts, but I got kicked off. So I was left without health insurance. What happens to somebody when they're left without health insurance? What I had to do was go to there's a few local places here that actually accept people without insurance, but yeah, that means you have to be a cash payer. When you're already broke and you have to pay cash for healthcare, and you have to choose between food or paying the doctor $40 to go see them, you choose food because food is medicine for me. So since 2022, how has this impacted my life? For one, it's delayed dental care that I needed, and I'm still needing dental care really bad, but I can't afford it. I can't afford to go. I went to see the doctor last week, and I'm going to do a video about what happened with that because I kind of mentioned it before. But they didn't even tell me that I was pre-diabetic. Even though the blood work shows that, they didn't tell me that. The doctors didn't. The way I found out was by looking at my labs, which you can do too. You can go and look at your labs. Right now, as it stands, I am pre-diabetic and have not been told by my doctor that I am pre-diabetic. I'm also deficient in vitamin or in folate, which is causing neurological problems for me at the moment, which I mentioned in the doctor's visit, that I'm feeling numbness in my right side and, all this kind of stuff. But they didn't mention that in the follow-up call either. Actually, the doctor didn't even call me at all. It was a nurse that called me. The reason I'm saying all of this is because when you're poor, when you don't have health insurance, like me, I do not have health insurance. I'm disabled technically. I have 4 things that qualify for on the disabilities list if you go to try to apply for disability, but I do not receive disability. Yeah, so I kind of, what would you want to call it? Freeball it. Yeah, I freeball life. I walk through life uncertain. And if I have to go to the ER like I did a few weeks ago for chest pain, which ended up being costochondritis, or some other weird thing that's associated with my connective tissue disorder, because it wasn't my heart apparently, and thank God, but it wasn't anything serious, even though it presents like it is. So I just can't, y'all. Even if we are in the system and even if we do get medical care, I spent 13 years trying to get diagnosed. They don't treat chronic illness or it's not really an illness, it's a condition. It's a genetic disorder that I have, a rare genetic disorder. But the thing is that our medical system is set up to treat things acutely. They are not really equipped for people who have chronic issues. And fortunately, and I know this because I went through it, not only that, but I have 8 years of upper level education in the School of Public Health and Science. I'm a scientist by education. I have a bachelor's in environmental science with a focus in human biology, and also 3 years of graduate school in bioinformatics, which is genetics research and studies, and molecular biology. So I know a lot about health and the body, a lot about health and the body. Educated in that field, and I'm saying that because I don't want my video to be flagged for misinformation. I guess my point to this video is, if you get kicked off of Medicaid from all of these cuts that's happening, you're not alone. And not only that, but there are most likely, hopefully, some local, usually faith-based organizations that will help you. And they do it on a pay scale. They recertify every year, which I've had to do the last couple of years. But also, it's faith-based. So all the doctors are volunteer doctors that are there because of their faith. So often you'll get the whole, can I pray with you? And I'm not joking. Can I pray with you? I just say, sure, why not? Because prayer is good, right? Prayer is good. But I'm not, that's not why I came to the doctor. I came to the doctor to get diagnosed with something, right? To figure out why my arms are going numb and why I am, experiencing these symptoms. And I know that AI cannot replace medical professionals, but what it can do and what it does for me is helps me pinpoint things that I might be able to take to my doctor and say, hey, these are the symptoms I'm having. And I usually bring a whole printed out list of the symptoms, and I give them the printed list because the printed list is on paper, and I ask them to put it in the file so that there is no mistake that I did not mention something to them, because that happens often. I record all my doctor's conversations, and not only that, when my doctor's visit is over, I wait about 3 or 4 days, especially if they take labs. And then I go into the portal. If I don't see the information in my patient portal on their website, I go directly to the lab they used. You can ask the doctors about the labs they use and then find out, what lab do you send your samples to? Send your samples to a lab and then go to that lab. If it allows you to, AEL is one that actually lets you log in as a patient, so you can see your labs. And had I not done that several times over the past 5-6 years, then I would have not have known that my blood was off and that I needed to make changes to my diet and my lifestyle to help fix those things. So I make a little changes to my diet and my lifestyle, they get better, especially for my liver enzymes, which were super high. I had a viral infection, norovirus, which really it could throw off your liver enzymes up and down, AST, ALT, all that stuff. If you're scared about to get kicked off of Medicaid, start researching now what facilities and places will accept you on a sliding scale for your pay. And I know this is a long one, I'm sorry, but I felt like this was important to talk about today because of what's happening right now with Congress. So also what it does do, and this is the harsh reality, is it delays care. It delays preventative care. I'm supposed to have an MRI of my, these thingies every year because I have fibrocystic breast disease. So it all connects with the connective tissue disorder. They cannot visualize through the denseness in there. So they have to do MRIs at least once a year. I was getting that care, but I have no longer had that. For the past 3 years, I have not had one. Also, I had a polyp in the past, so I'm also not getting that kind of care because the last doctor I went to see, he yelled at me and I refused to go back to him. And they won't let me find a female doctor to work with for the colonoscopy. I'm also supposed to be getting an MRI of my brain every year because of the connective tissue disorder. A few years back, I had a brain bleed, which caused all kinds of stroke-like symptoms. And I went to the ER, and that's the visit where they said that I had anxiety. And not only that, they put in my chart that I had Munchausen syndrome. And I didn't find that out until I looked at downloaded the PDF and looked at the doctor's notes, and I cried. I was like, are you joking with this? Do you think that people with these kind of problems want to feel this way? No. We want to be freaking Wonder Woman. We want to be the best we can be for ourselves and our family and our friends. We don't want to have to sit on the couch. I don't want to have to sit on the couch. I hate that. I like to move. But when I move, I almost pass out. And when I move, my muscles hurt really bad and my joints pop out of place and all kinds of weird stuff happens, but I keep going through my day and I don't look sick. And that's the problem with connective tissue disorder. People look at you and they see the things you do. Like I skate, but you know what? I haven't skated in a long time because this progressive thing that I have is starting to really get me. Like right now, as I'm speaking and holding my phone, there is a pain. It hurts to hold this phone from my hand all the way up to my shoulder because this shoulder is permanently out of alignment and won't go back because my tendons will not keep it in place. And I have to change right now because it really hurts. But see, you don't know somebody's pain they're going through just by looking at their face or what they look like. You don't know, but if you see what connective tissue disorder looks like under a microscope, you'll see the fibers and what it happens. That's the pain. And also, I look younger than I am. I'm 53. I'm 53 years old. It makes you look younger. And that's the only benefit it gives you.
I am so frustrated, so I thought I would just vent a little bit and tell everyone why I hate Medicaid. A love-hate relationship. So we get a letter. Emmett gets a letter in the mail, and it says, basically, because I've failed to cooperate with them, with submitting his health records, that they're going to cancel his Medicaid on April 1st. And I got this letter. It was like dated March 1st or March 2nd. I don't know, but I didn't get it till like March 15th. So of course I call right away and a lady tells me, oh, she said, yeah, we need these health records, blah, blah, blah. And I was like, that's weird. I didn't get anything else that said I needed to submit this, but whatever. And she's like, actually, all you need to do is sign a paper, a health release form. And she's like, and I would go to the office because stuff gets lost in the mail or you don't want to fax it. I was like, okay. So she gives me the local office. It's in Winchester. And I drive to Winchester. I think I do it like the next day. So I go to Winchester. I have Lottie with me. Emmett's at therapy. And we're waiting. And it's kind of a mess there because they're switching offices. And the lady looks up his case. She said, I don't see anything on here. I don't see anything that you need to do. Everything looks good. I was like, really? I was like, I just called like yesterday. And this lady said I needed to sign a form. And she's like, yeah, I don't think you. I was like, can I please just sign the form? And she's like, no, you don't need to do anything, but I'll take your number and I'll call you if you need to do something and come back. I was like, great. So I worked the next couple of days and okay, fast forward to yesterday. So yesterday's March 31st. And I was like, I just got a bad feeling. I'm like, they never call me back. I don't trust them. And they say they're going to cancel it on the 1st, which is today. So I call first thing in the morning. And they're like, oh, yeah, we have here that we need to cancel the services tomorrow. I'm like, really? Because I was just at the office last week. Okay, sorry. My phone just ran out of storage, so I had to delete stuff. But I don't remember where I was at. I think I had a funny feeling that stuff was still messed up. So I called, and she was like, yeah, they're canceling his Medicaid tomorrow. And I was like, excuse me? I went to the office and they said everything was good. And she said, well, we need his medical records to prove his disability or whatever. And she said, if you can get me those by 4:30 today, everything should be okay. I'm like, okay. So I'm calling. Emmett has a Medicaid waiver. The waiver is something you have to be like on a wait list for. And when you have certain disabilities that qualify for it, you get the waiver, and then in turn, it waives your income so you can get Medicaid. So we have the waiver. Nothing's wrong with the waiver. But the problem is the people at the waiver, like they don't communicate with Medicaid, if that makes sense. So I call our case manager for the waiver. And she's like, yeah, there's not much I can do, but I can give you these papers that we have that like his doctor had signed, like confirmation of diagnosis and all this stuff. So she brings those over to my house, and then I gather up what I have, which is like his autism diagnosis from Riley. I'm messaging his ABA place because they just re-diagnosed him because our insurance that we pay for wanted an updated diagnosis. So we got that, which is a whole nother thing. So I get all the paper and I drive to Winchester again, and I get there and they of course have no idea what I'm talking about. They think I'm trying to like apply for disability. They have no idea. And he's like, well, I'll take these, I'll scan them in, but I don't know what it's going to do. I'm like, please just take them and upload them to wherever, like begging them, arguing with them. So he does, and luckily he gives me back all the documents, and it has like their little stamp on it that they uploaded them to his profile, and they did it at 2:00 and all that. So I did what the lady told me to do. So then I get home and I'm like, you know what? I better just call to make sure they didn't screw something up again. So I call, and the lady's like, okay, I see we got your documents. We got some on March 25th. I'm like, I don't even know when that happened. I don't know about that, but she's like, and then, yeah, I see that you called someone today and she told you to get these in and you did. Let me just check everything. And then she's like clicking and she's like on the phone. She's like, oh, like making these noises. And I'm like, what? And she's like, yeah, I'm just having trouble verifying this and opening up the case. And anyway, she tells me she's going to have to call me back. And I'm like, I'm never going to hear from her again because it's almost time to close at this point. So that brings us to today. And today I call, obviously, of course. Why wouldn't they? I call and I was like, I'm just checking on my son's Medicaid. I'm following up with stuff. And they're like, oh, it's not active. We canceled it today. I'm like, and I knew you would. I knew you would. They're like, yeah, you failed to provide. I was like, hold up right there. I was like, stop saying I failed to cooperate. I told him this. Actually, what I should have said was, are you April Foolsing me right now? Because this should be a joke. But anyways, because she kept saying, you failed to cooperate. I said, all I have done is cooperate. I have overly cooperated with you guys. Like, as soon as I found out about this, I did everything. I did things that I think they should have done. Like, personally, I think if they have my son's pediatrician info, they have all this stuff on file. Like, if they need it, they should contact the doctor's office. The doctor's office sends them the stuff. I don't know why it's always, I don't know. It's just always you're such a middleman. Like, I'm always such a middleman for all these places. So anyways, I was like, I've done nothing but cooperate, like, since. And she's like, well, ma'am, we told you about this in March. It seems like this is today I'm talking to her. I said, I know. I said, I've been to the office multiple times. I've talked to multiple people since I've gotten the letter. She's like, okay, let me check. And she's like, okay, someone's actively working on restoring that right now. She's like, but they have to make sure it's going to be canceled. His Medicaid will be canceled until they decide basically if what I provided was good enough or not. And I said, well, how long will that take? Because he gets a lot of things through insurance. And she's like, well, I don't know, maybe 1 to 2 days. Well, I feel like it's going to take longer than that, and that's where we ended it. So anyways, I just wanted to vent, let everyone know this isn't the first time. We've had similar stuff like this happen. Like, when he first got Medicaid, I had to jump through a lot of hoops to prove stuff, and it's just so frustrating. And I think the part that's most frustrating is the fact that I pay for insurance through my job. And Emmett's still on that. And like, if that insurance that I paid for would cover stuff, we wouldn't be so reliant on Medicaid, but we are, because like his safety bed, we got through Medicaid. IU Health denied it. His stroller, IU Health denied, we got through Medicaid. His car seat, special needs car seat, like all the things that keep him safe, our insurance that we pay for denied. IU Health only pays for a certain amount of speech. I mean, Emmett's completely non-speaking, so That's crazy also. They only cover so much of his therapy, like his behavior therapy. So it's frustrating to me that we have to fight so hard just to get him things like when, I don't know, like when the insurance we pay for to like won't even consider covering this stuff. So that's why we're stressed. Medicaid also provides him with like his nutrition shakes because he um, has avoidant restrictive food intake disorder. So he doesn't eat certain things, and so he's on pediatric shakes. Medicaid provides those. IU Health denied it. Medicaid, anyone who's over 4 and is still not potty trained, Medicaid will cover pull-ups. So that was a huge expense that we got covered. IU Health doesn't pay for that. So there's just a lot of things that we're thankful for that he's on this insurance. And yeah, it's just frustrating that we have to constantly fight with them. So thanks for listening. Happy April. April is Autism Awareness Acceptance Month. So just wanted everyone to know the struggles that go on behind the scenes. And here's my sweatshirt. It's probably backwards, but it says, "You can do hard things." Yay.
My mom is 59 years old and she lives in a nursing home. She became disabled after having me, and she's been on Social Security disability benefits since 1992. These benefits pay for her 20 different medications that she takes several times a day. It pays for her nursing care. It pays for the living expenses that she has there. And in April, she got a letter from Social Security stating they had reason to believe that she was no longer disabled and could re-enter the workforce. She's been eligible for disability for 34 years, but now she's capable of working, a resident of a nursing home. Tell me again how these Medicare and Social Security cuts aren't going to affect us.
So Ronald Reagan lied to everybody, well, his base, about this whole trickle-down theory. Here's how trickle-down really works. Republicans pass policy and a whole lot of shit trickles down. Let's talk about these Medicaid cuts again and how it's affecting the world of rehab, drug addiction rehab, alcohol rehab. So there's these work requirements now, and with very few exceptions. And when you're in the throes of addiction, there's something like 40 million people in the United States actively fighting an addiction. Some of them are functional. They can make it through their day, their work day, they'll be able to stay employed. But for all of you that understand addiction, who've been touched by it, you know that's not often the case. They will hit rock bottom. It could be a father who starts to become violent because of addiction. It could be a mother suffering from alcoholism. Every single day is drinking a lot and choosing to get behind the wheel of a car. It could be unaliving, attempts to unalive yourself because it's it's mental anguish to be in the throes of addiction, okay? And they're getting fired all the time. They can't keep their jobs. Maybe they're showing up for work, but because they're showing up impaired, they're making mistakes that can actually be fatal if they're operating machinery, could be dangerous to their coworkers or the general public, okay? Nonetheless, they hit rock bottom and their loved ones convince them to go to treatment. And that's where we're all fucked. Unless you have private health insurance, you're fucked. And a whole lot of MAGA is on Medicaid. This is really bad, you guys. There are rehab facilities already getting ready to shut down and letting people go because almost all of their income comes from Medicaid recipients who need help. And you can't keep a job when you go to rehab. Are you going to quit that job and lose your health coverage, your Medicaid coverage for the rehab center? No, you're screwed. So we're going to have something like 40 million people, a large percentage who can't get treated for their alcoholism or their addiction. This is terrible. Add to that dirty little secret. A ton of employers no longer do pre-employment drug testing or alcohol testing because it's hard to find work. They'd rather take somebody not knowing they're showing up impaired. that's a whole nother issue in and of itself. Other people's whose lives are put at risk if they're operating heavy machinery or what have you. Let me tell you who can afford treatment. The billionaire class, the ones that are getting another $4 trillion in tax cuts. Alcoholism and drug addiction affects everybody. It doesn't matter whether you're rich or poor, black or white, gay or straight, it doesn't matter. But the billionaires will be able to send their adult kids or themselves to a $100,000 a month state-of-the-art treatment facility, paying out of pocket. Yeah, but you won't. When your kid is crying for help and your family's on Medicaid, crying for help, and you can't send them for treatment, they finally need help, they want to go to rehab, you're fucked. And that's how Republican trickle fucking down theory works.
I genuinely have no idea what to do. I was just denied Medicaid for my pregnancy. I do not make enough money, so this is just... Any advice?
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, you know. What we want to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues can be linked to the pesticides she was exposed to while working in the fields.
Look at me right now. Look at me, how many sicknesses that I have. We got all in the fields. Where else? I feel like these stubby nuts in the back, you know. But why? Why when we put food on their tables? Trump promised a lot of things. I thought it would be more family values and those programs that they really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country.
Can you guarantee that Medicare and Medicaid will not be touched?
Yeah, I mean, I have said it so many times, we're not going to touch it.
The yeas are 218, the nays are 214. The motion is adopted.
This bill represents the largest cut to Medicaid in American history. It will devastate vulnerable populations.
The largest tax break go to the wealthiest individuals. Are those your values?
No, that's not right.
Irma isn't the only one in District 22 who feels betrayed by the administration's plan to gut Medicaid.
The only people they're hurting are the poor people, people that really need the stuff. Elon Musk doesn't need it, Trump doesn't need it, and billionaires don't need it.
They're making out big time with this, but they're hurting people in the process.
If we could go back to November, who would you vote for now, seeing what you see?
Not either one.
You just wouldn't have voted.
Not either.
Hey guys, well, y'all were right about Trump. Not that I voted for him, please understand, because I did not. But April 1st is very true because I got my letter today. Both me and my husband have been totally kicked off any medical, and it starts April 1st. Now, he was only on a spend down because he also has Medicare, which was fine for him. And all he needed was his prescription help, which he joined another program anyway because things were getting really funky for him. But I found out today that as of April 1st, I no longer will get any help whatsoever. I did a lot of crying today. Apparently, my husband told me I had seizures today. Apparently, it was a really bad one. It took both him and my son in order to calm me down because I apparently hurt my husband really bad, and my son had to help grip me off of him because I don't know what I'm doing. And it's not a good thing because I have a couple of life-threatening things going on inside my body where I do need medication for. And I can't afford to pay for it because we're barely scraping by to pay our bills. And I don't know what I'm going to do. And I called welfare. And she says that my husband makes too much on disability. Now understand that sentence. He makes too much on disability. I'm not even sure how that's possible when we can't even pay our bills. We don't get food stamps, so we pay for our own groceries. We pay our electric, we pay our water, we pay for everything. There is nothing that we get handed to us. We make every frickin' dollar stretch. I do not take rent from my older son because you know what? He's saving up so that he can move out on his own, so he can do the things he needs to do. And I want him to do that for himself. He did not ask to be born into a family that's poor, and I'm not going to take that out on him. All you people who voted for Trump, thank you. Thank you for taking away from my livelihood. Thank you for taking away from my health. Because now I don't know what I'm going to do or how I'm going to take care of my family or how I'm going to take care of myself. I'm scared. So please pray for me because I am terrified.
So here's the update. After calling like 20 some people, every person I could think of to help me, and being treated like total garbage from several people that are supposed to serve the needs of kids like Jameson. They called me about 3:00 in the afternoon to tell me that they manually went in and fixed the problem that they created in their system, and he had active Medicaid. So of course, I'm scrambling because it's, the Thursday before a holiday weekend. I know everyone else has either clocked out or checked out, so I had to hurry. I called the home health company, and the lady on the phone said that she could see that he was active, and she would send a notification to the scheduling team to get him back on the schedule for in-home care. And then about 5:00, after everyone's gone, I get a message from the scheduling team that they tried to put it through and it was not active, which is a lie because the lady saw that it was active herself. And FSSA supposedly called them and said, services must resume. You will be reimbursed for the time worked. So, the services should have never stopped. But, whatever. And the hours that I worked, because I work as his home health aide, the hours that I worked on Tuesday were deleted out of the system, which is illegal. But anyway, I digress. So here I am. It's 4th of July. The big ugly bill passed yesterday, which is a totally different topic of conversation. Supposedly Jameson has Medicaid, but his feeding tube order is still on hold. He has no in-home health care. Nothing got accomplished, basically. Nothing got accomplished. So anyway, at least if he has an emergency today, it will not bankrupt my family to take him to the hospital. Yay, small win, I guess. Anywho, I will keep updating. It's been a very frustrating few days, and I'm not really in the mood to celebrate the 4th of July, but it is what it is.
Do you know what's going to be the ultimate result of you being an ableist piece of shit? Going on the internet and saying, I'm okay with these Medicaid cuts because I'm an able-bodied person and we just need to quit expecting the government to give us handouts. Listening to the Trump administration saying that this is just about waste, fraud, and abuse and refusing to read the goddamn bill. The result of that is going to be that you one day are going to be sitting there with your thumb up your ass when your mama in the nursing home loses her Medicaid coverage and can't afford to stay in the home anymore. You're going to be sitting around going, what's happening? When they take away your kids' SNAP benefits and you have to send them to school hungry. We are all one traumatic injury away from losing our jobs, losing our health care, and being unable to afford groceries. Your child is one traumatic brain injury away from needing special services at school that require Medicaid coverage for the rest of their school life. And y'all are frothing at the mouth so much to watch people drop dead because they can't afford to take care of themselves or feed themselves that you're willing to overlook all the other shit in this bill. Your dear, darling, genius child you've wanted to be a doctor their entire life won't be able to afford medical school anymore because the government doesn't think that they have to help with those. In fact, your child, who probably is going to need Pell Grants and assistance of some kind, won't be able to afford college at all, much less medical school. Y'all, I had to record this in my car because I was so goddamn mad. I didn't want to disturb the neighbors. So frustrated right now because everyone is just wanting to see other people suffer. Where is y'all's humanity? Where's the humanity? We've lost it all. We're just willing to let people starve, including children.
Trump has cut my food stamps from $2,800 down to $350. Now, what am I supposed to do? So I literally just got this piece of mail today saying that due to new policy changes from the Trump administration, all this shit, whatever, that all these cuts and whatever he's doing over there, now they're telling me I have to go work. Now I have to go do all this. Well, I literally got 5 kids. Okay. I'm trying to sit here and spend time with them. I'm not trying to go work, 50, 60 hours a week so I can pay bills. I just really don't understand. I voted for him this last election because I thought what he had good was going on, but now all of a sudden, all this policy stuff's coming out, and now he's making all these cuts, and now he doesn't want to help the less fortunate people no more. I'm done with that guy. I'm not. If he gets voted in again, I'm leaving this country. Because I'm not dealing with this no more. This is all shit.
We have breaking news right now. United States Senator Ron Wyden from Oregon says that his staff has officially confirmed reports that Medicaid portals are now down in all 50 states following the federal government's decision to implement a federal funding freeze. Essentially, the Medicaid payment system is no longer operable in all 50 states, according to this Oregon senator. This comes as the White House is refusing to comment whether or not Medicaid will be impacted by the federal funding freeze. Medicaid is a critical government-funded program that millions of Americans rely on. That program is coming to a complete halt at 5 p.m. and it really already has over this federal funding freeze, and it potentially could only get worse with more government programs on the chopping block, including childcare, healthcare, food inspections, and so much more. I did a full breakdown on all of the federal programs that could be impacted on my Substack linked in my bio. I will continue to provide you updates throughout the day as we get more information, so be sure to follow along for all the news you need to know about both on here and my other social platforms linked in my bio.
Well, y'all, they're going to be complaining for the next, what, 3.5 years Donald Trump is in office, because a lot of people, the ones that don't get cut off this year from Medicaid, they will get cut off in 2026, especially after the midterms. See, the Republicans don't want to do too much. They are doing some people now, but they're going to do the bulk of it after the midterms next year. You know, they don't want to do too many cuts because they fear Republicans will lose. And I think they're going to ultimately lose anyway, because Donald Trump is doing too much all at one time. And it's overwhelming a lot of them. And I was listening to it was a video, and a clip of it was Steve Bannon. And Steve Bannon was saying this Medicaid cut is going to devastate MAGA. There are a lot of MAGAs on Medicaid, a lot. Even he said that. And he said all these cuts are going to devastate them. Well, Donald Trump don't care. He even told them to their face, I don't care about you. I just want your vote. You know, he told you straight to your face he didn't care about you. So, I mean, what do you expect? You sat there and chose to believe a criminal. You know, it is what it is. So, y'all, I am going to conclude. I thank you for being here. And, well, yeah, Steve Bannon, we know Steve Bannon is a racist. Yeah, you know, he certainly don't care if our people get cut off from Medicaid, Chris G, just his people. So, but they are the ones that like to point the finger and say welfare at us, while they are sitting over there with the most welfare. That's how it works. So, y'all, please enjoy the rest of your day. Please keep the True Royal family in your prayers as she recovers from her stroke. Shalom, family.